All right, today we're diving into the incredible evolution of surgery for lymphedema, a condition that can be truly life-altering. We're going to take a journey from some of the earliest, most drastic procedures all the way to the delicate, microscopic repairs that are changing lives today. And it's a really fascinating story of medical innovation, so let's get into it.
So what's really going on here? Well, at its core, lymphedema is basically a plumbing problem. Think about it. Your lymphatic system is this huge network of tiny vessels that's supposed to clear fluid from your tissues. But when that system gets damaged or blocked, imagine a massive traffic jam on a highway. That fluid just backs up. This leads to swelling, and over time, a bunch of other tissue changes. It all comes down to that fundamental imbalance.
You know, for many people, conservative treatments like compression garments and physical therapy are the first line of defense. But what happens when those just aren't enough to really get the condition under control? That's where surgery becomes a really powerful option. So the big question is, what can it actually do? Let's break down the possibilities.
So here's how we're going to tackle this. First, we'll get a handle on the core problem. Then we'll look back at the radical early attempts to fix it. After that, we'll explore how surgeons learn to actually rebuild the system itself. We'll also see how some of those older ideas have been modernized, how these intricate repairs are planned, and finally, what this all means for patients today.
And here's the thing, it's not just about some extra fluid. When that lymphatic flow gets sluggish, it kicks off this whole chain reaction, this cascade of secondary changes in the tissue. You get an accumulation of fibrous tissue and fat that actually makes the problem progressively worse and harder to treat over time.
For the longest time, the surgical mindset was kind of like, hey, let's just mop up the flood, you know? The focus was all on the flood water, the excess bulk, without ever addressing the broken drainage system that was causing the flood in the first place. And that brings us to the very first surgical answers. And, well, to put it lightly, they were pretty aggressive. The philosophy was super simple. If there's excess tissue, let's just cut it out.
Okay, so picture this. It's 1912 and the Charles procedure is considered state-of-the-art. This was an incredibly radical approach. Surgeons would literally remove everything down to the muscle, all the skin, fat, and fascia, all the way around the limb. Then they'd cover the whole area with skin grafts. Just wild.
And yeah, you can probably guess what happened next. A drastic solution like that, it came with some really drastic problems. While it did reduce the size of the limb, patients often had to deal with serious, long-term complications in the grafted skin. It was a pioneering effort for sure, but man, it really highlights just how far we've come.
Okay, this is where everything changes. A huge philosophical shift happens. Surgeons started asking, instead of just removing the damage, what if we could actually fix the broken highway? Can we rebuild the lymphatic system? This was the dawn of reconstructive microsurgery.
Today, there are two really brilliant strategies for this. Think of it like trying to fix a traffic jam. The first option is to create a detour. This is called a lymphovenous anastomosis, or LVA for short. Surgeons connect a blocked lymphatic vessel to a tiny nearby vein, which lets the fluid drain into the bloodstream instead. The second option? You build a whole new bridge to get over the blockage. This is called autologous lymphatic grafting, where healthy lymphatic vessels are taken from another part of the body and transplanted to bypass the damaged spot.
Building one of these new lymphatic bridges is just an incredible feat of microsurgery. First, surgeons carefully harvest a few healthy lymphatic vessels. Then, they create a small tunnel under the skin to get around the blockage. And then, and this is the amazing part, using a high-powered microscope and sutures thinner than a human hair, they connect those transplanted vessels to restore the flow.
So does it work? Oh yeah, the results are seriously impressive. In one study of 214 patients with arm lymphedema, the average volume of the arm was significantly reduced after this grafting surgery, and that reduction held up over the long term. This isn't just a number on a chart, this is a real, measurable, lasting improvement in people's lives. But hold on, what about that old idea of just removing the excess tissue? Well, that concept didn't just disappear. It got a major, sophisticated upgrade. Instead of those radical excisions, surgeons can now use a much less invasive technique, liposuction.
All right, take a look at this number, 104%. What on earth could that mean? This is the average edema reduction for patients who got liposuction combined with controlled compression therapy after a year. How is it possible to have more than 100% reduction? It sounds impossible, right? Well, this quote right here explains it. The combination is so effective that the treated limb can actually become even slimmer than the patient's healthy, unaffected limb. It's a super powerful tool for getting rid of that chronic, fibrotic, fatty tissue that builds up. But, and this is a big but, it has to be followed by lifelong compression therapy to maintain those amazing results.
Now, all of these super advanced microsurgeries, rerouting the flow, building new bridges, they all depend on one crucial thing: incredible precision. You can't fix what you can't see, right? So modern surgery relies on some amazing tools to map out the body's lymphatic highways.
Which, of course, leads to the big question. We're talking about vessels that are fractions of a millimeter wide, practically transparent. How on earth do surgeons find them and figure out a route for the repair before the operation even starts?
The answer, of course, is technology. The key test is something called lymphoscintigraphy. A tiny bit of radioactive tracer is injected to create a functional map, kind of like a GPS for the lymphatic system, that shows exactly where the blockages are. MRI can also give these incredibly detailed pictures. Then, during the actual surgery, surgeons often inject a special blue dye that stains the lymphatic vessels, making these invisible structures just pop into view so they can work their magic.
So when you take a step back and look at this whole journey, from radical cutting to precise reconstruction, what does it all really mean? Well, it means we're in a completely new era of treatment, one that's all about restoring function and dramatically improving quality of life.
Look, the entire philosophy has just flipped on its head. We've gone from a mindset of removal to one of repair. Precision has replaced brute force, which means way better outcomes with fewer complications. This innovation gives patients real, tangible hope, improving not just the physical swelling, but their overall well-being. And none of it would be possible without the ability to plan these surgeries with incredible detail, tailoring every procedure to each patient's unique body map.
You know, this remarkable progress leaves us with one really exciting final thought. We've come so far from those radical operations a century ago to the microscopic repairs of today. So as our imaging gets even clearer and our surgical techniques become even more refined, what's next? The future for treating lymphatic disorders looks brighter than ever, promising solutions that are even more personalized and effective.